Good morning, this is Gayle Palmer from the Living Elements Clinic near Siddlesham, and I'm an osteopath. Today's video is about plantar fasciitis. What is plantar fasciitis, I'd hear you say? Well, it is a really painful, somewhat debilitating condition which causes pain on the sole of the foot and around the heel most typically. It can stop you walking properly because you aren't able to use the movement in the sole of your foot and your foot mechanics properly. The plantar fascia is an area of really thickened tendon and ligament which goes from the inside the heel of the heel and attaches to the bone at the back of the foot and then goes forward along the sole of the foot, deep in the base of the foot to all of the toes. It causes inflammation and it has an excellent nerve supply, so it's very good at producing inflammation, not so good at healing because its blood supply is less well attributed. It can result in lots of gait changes, which is not good when you want to walk. And it's typically called jogger's heel because it's often brought on by extra stress and pressure as you're weight bearing. It can be aggravated by a whole range of things, poorly fitting shoes or boots. So you see it quite often in the military. If you've increased your workload substantially, so you've gone from being fairly sedentary, suddenly taken up doing 5-mile jogs to get fit, that will cause problems for you often. And for me, there are a few things that I see typically in practice which occur along with the plantar fasciitis. So you get a lot more muscular tension in the calf muscles, the gastrocnemius and soleus, and also around the Achilles tendon, which is the tendon which attaches to the back of the heel. And that can be exquisitely tender as well. I find there's often a malalignment in the tibia-talar joint, which is the joint between the tibia, the long bone in the leg, and the talus, which is the first articulation. And it operates like this. So this here is the tibia, this is the talus, and that's that ankle movement that you get. And you often find there's a malalignment in that articulation, which then stresses the rest of the foot dynamics. That along with that, there's often a problem with the fibular attachments, and the fibula is the knuckly bone on the outside of your ankle, either right down at the bottom of the foot or further up by the knee. You can't fully dorsiflex the foot. It will only go so far, and that isn't necessarily restricted by pain, it's actually a physical restriction. It's much more common, I find, in whichever foot you lead off from. So if you're right-footed, you tend to lead off on your right foot, so it's more likely to occur in that foot, as that's your leading foot. So that's an interesting thought, isn't it? Although I said all of that, those are the findings that I have most commonly. The thing about plantar fasciitis is that it is individual in every single person. There is no one solution that will solve it for everybody. It tends to be relatively self-limiting, lasts about a year or so perhaps. And there are various factors that definitely make it worse. So pregnancy, because you end up with an increased amount of fluid around that area. Obesity, you've got more weight bearing. Direct trauma, so jogging, shoes, that sort of thing. Postural differences. So if you have a short leg on one side, you'll weight bear differently. If you have spinal problems further up, that can then affect the posture in your legs and feet, and that will increase the likelihood of having problems. All sorts of things can make a difference. Icing, although I find that not very effective because the tissues are really deep into the foot, and it's fairly temporary. But lots of people recommend it, or a variety of hot and cold compresses can make a difference. Directly applying anti-inflammatories can make a difference with gels, creams. In extremis, I've had patients who have had steroid injections from the orthopedic consultant. I genuinely don't know if they make that much difference, to be fair. The injection has to be extremely site specific. You miss it by a tiny amount and it doesn't make any difference. And they tend to wear off as well. So I think over time, a conservative treatment makes the same amount of difference as having an injection, although it probably feels a bit more dramatic. So you might feel a bit better as a result with the placebo effect. Wearing properly fitting orthopedic shoes makes an enormous difference. I know flip-flops and unsupportive shoes definitely aggravate it. And then getting shoes that fit comfortably around the heel can help. Sometimes wearing orthotics will also make a difference. Those are inserts that you put into the foot which change the shape of the arch or how your rotation is in your ankle. That can often make a difference, and I have those here in the clinic. Sometimes wearing a splint at night to help support the foot helps. Definitely in the early stages, not wearing high heels. Not having really flat shoes, because when your foot's at that angle, I can't do it obviously with my wrist, it's not the same, you're stretching out those solar structures. If you have a slightly raised heel, they're not getting stretched quite so far. So sometimes wearing shoes with a slight heel makes a difference, and then over time as things start to resolve, you can lower the heel and start walking better on the flat. There are all sorts of exercises that you can be given, but particularly working around the calf and ankle area. Sometimes they make a difference, sometimes they don't, but osteopathic treatment definitely helps. So if you or a friend have plantar fasciitis and you want to be looked at by an expert who is used to dealing with this horrible problem, because it really can blight your life, then give us a call at the Living Elements Clinic. You can go to the website livingelements.co.uk, and I've also written a blog about this, so if you want to find out more, have a look at the blog on the website. Thanks very much. Take care for now. Bye bye.